All right, it is Monday, which is time for our regular COVID update. Let me first start by recognizing the sad news that America lost an incredible hero today in General Colin Powell. General Powell, his service is well known by all Americans. Tomorrow, we are ordering our flags to half staff, and that's going to be lowered until sunset on Friday, October the 22nd. The pinnacle of his career, General Powell served as chairman of the Joint Chiefs of Staff from 1989 to 1993 and U.S. Secretary of State from 2001 to 2005. We'd encourage and ask businesses and organizations throughout the Commonwealth to join these tributes and to lower their flags as well. On a personal note, my mom sat on a nonprofit alliance with General Powell and said personally he was as incredible as most of us believed him to be from his public service. His family also released a statement talking about the fact that he was lost to COVID-19, or at least in part, and how critical it is that everyone get vaccinated, not just for themselves, but to protect those around them. And that would include General Powell, who suffered from some conditions that made him more susceptible. We are losing a lot of people, both in Kentucky and around the country, in this pandemic. And each one is amazing to their family, to their community. Let's make sure that we do not lose more than we have to. So in today's report, what we're going to see is just about everything is moving in the right direction, and actually at a speed that the decrease in cases and in hospitalizations, ventilators, and ICUs is significant. It is a real trend. It's a positive trend. It has not plateaued. It is moving downward, which is reason for optimism. But our deaths, which trail cases and hospitalizations, ICUs, and ventilators, are still very high. In fact, over the 3 days we're reporting on today, Saturday, Sunday, and today, Monday, we've lost 103 additional Kentuckians. So Saturday's report, 1,751 new cases, 50 new deaths. That is a tough day in the Commonwealth. We continue to lose people under 50 years old at such a higher rate than at any time previous in the pandemic. We lost a 46-year-old man from Floyd County, a 46-year-old woman from Hart County, a 45-year-old man from Rowan County, and a 49-year-old man from Warren County that were recorded in Saturday's report. We moved to Sunday, 827 cases, 22 new deaths. They included 2 women in their 40s in Hardin County. Actually, there were 8 Hardin County deaths, some of them catching up, but all of them from the Delta variant time period. But a 40-year-old woman and a 47-year-old woman, both from Hardin County, and a 49-year-old woman from Marshall County. And then we hit today 678 new cases, 31 new deaths. Those include a 46-year-old man from Allen County and a 49-year-old man from Warren County. But some of today's numbers are much better than what we have seen in weeks. Our positivity rate now down to 7.36%. That is a significant drop. Remember, we were always worried at 5%, so it's still too high, but it is good that it's dropping, and we'll show you the rate in a minute that it is dropping. 1,193 Kentuckians currently hospitalized with COVID-19, 337 in the ICU, 219 on a ventilator. We'll show you how all these trends are moving in the right direction. Let's start with our stair stepper on cases. I was excited to see some of these numbers, especially the last 2 weeks. We hit a point in time in this decline where it looked like we could potentially plateau. The plateau, if it was at The rate 3 weeks ago would have been far too high for us to sustain. It would have been far too high for our hospitals to continue. It would have resulted in amounts of death that we only saw back in the major surge in the fall and in the winter. But we continue to decrease now at a case rate from the last 2 weeks below the highs that we had in the fall and winter surge. If we continue to see these numbers come down at the rate that they are, we will be in a much better place within a month or so. What we'd like to see is this continue at this very significant rate. Notice the fall, the plunge from the peak is moving faster than at any time during the pandemic, including when we were first able to begin vaccinating folks. But the trick, the thing we've got to work towards is making sure we can keep it down and not see another surge again. James or Jim, you want to show the week by week that we normally do, the second? Yeah. So this is just another way when we focus in a little closer on the Delta variant time itself, removing everything else. And you notice there was just slight variation on the decrease. If you look 3 weeks ago, that's when we were worried it might have been flattening out a little bit at the rate of decrease. But that hasn't been the case. This is good news. Positivity rate, also very positive news. The rate decreasing now to under 8%. And what we're seeing are real drops week after week. Again, we want to see this trend continue. And if we zoom in on just the time period for the Delta variant, the decrease isn't quite, the slope isn't quite as severe as the exponential rise, but this is a faster drop, I think, than we've seen at any other point during the pandemic in positivity rate week after week. Let's look at the charts that really mean something to our loved ones. Let's look at hospitalizations. Again, a strong downward trend, now below the hospitalizations we saw at the peak of the winter and the fall surge. That's something we haven't been able to say really until this last week. Same is occurring in the ICUs. Remember, you got to be pretty sick to get into an ICU. We think a couple things are happening here. One is more people have been vaccinated. The second is many people who haven't been vaccinated have already had the virus. But the third is these antibody treatments, when people get them and get them early, really work and keep you out of the ICU. Now, in another positive sign, the antibody treatment requests are going down as well, meaning there are fewer very sick people that are requesting them. And finally, let's look at ventilators. So this is the only one that's not below the peak for the winter and fall surge. Let's call that the Alpha variant. And it's getting there, but I think in part it's because the Delta variant has made people that much sicker, that it was more aggressive with the people that it infects and what their outcomes are. We definitely saw a rise in ventilator use. I don't know if we've seen in our history, certainly not in my lifetime, but we are seeing a significant downward movement. But that doesn't mean that we aren't still losing a significant number of people out there. I think since the last time we did an update, we've lost a county judge and at least one magistrate, along with countless other amazing Kentuckians. So we need to keep it up. Listen, things are getting better, and that's good. It's really good. But that doesn't mean that it is safe and that we're completely out of the woods. It means we got to still be careful around one another and make sure we're doing the right things not to spread the virus. It means we've got to keep universal masking in our schools. My goodness, the first thing that would pop these numbers back up is if we came off universal masking in schools, because that's the largest population that is unvaccinated. They're in the smallest space and it's the least ventilated out of just about any type of buildings that they will be in. That's how flu spreads. That's where all the experts have come to consensus in battling this virus. So let's be smart. And we want to get this thing down, keep it down, have as much of our lives normal as possible. Does that mean we got to wear a mask inside for a while longer? Sure. But we've done it enough. We can get there. We just don't want more people to die. We want people to be healthy, and we want to eventually beat this thing once and for all. Hospitals, still treating a lot of people, but it is easing. Hospitalizations have decreased 10% over the last 7 days in our rolling average. 194 ICU beds available. I think that's some of the most in a while. We're down to 59 of 96 hospitals with critical staffing shortages. So again, things are easing, but still have a number of sick folks out there, including 15 confirmed kids in the ICU. Let me back up. 15 kids hospitalized, 4 in the ICU, 3 on a ventilator. So we need to keep protecting, especially the most vulnerable amongst us who, if they are under 12, though Dr. Stack's going to talk about it in a minute, can't yet get vaccinated. That includes a member of my family. Over the weekend, 8,624 new vaccinations. We normally see more than that. We'll see what tomorrow's report brings in. We normally see 16,000, 13,000. But again, it's going to get harder and harder as we go. I would comment just real briefly that I saw a story talking about an analysis of vaccine lotteries. And having lived this and having made the battlefield decisions, it's not that I disagreed with the answer they tried to get to, but really the way they phrased the question. This analysis suggested that vaccine lotteries didn't significantly increase the number of vaccines being given. Folks, the number of vaccines before we did our shot at 1 million was decreasing week over week over week in significant fashion. And what that did is stabilize it. Right when we announced that, the decrease stopped, and we had steady vaccinations for the next, in fact, several months. And so I think that a program can be successful without increasing numbers if it stops a significant and major decrease. Where we would have been without it concerns me. I do believe it did good work. It also resulted in, I think, over $100 million of media that was generated out of having that talked about the vaccine, that got it out there, that continued to spread the word. So there's a lot of different reasons to do something like that. And there's a lot of potential benefits that come out of it outside of just one set analysis. And I think that even the person who did that analysis says, yes, we should have tried it, but I do disagree on that it wasn't really beneficial in where we were projecting where we would have been on vaccinations versus where we ended up thanks to doing that and other programs. Real quickly, just some numbers in on our K through 12 COVID testing program. Remember, we had vendors available to each schools. 1,142 public, independent, private, parochial schools that are participating in the program now. 86 of 120 counties have representation through participation in the program. Remember, it's out there for everybody. It's the school and the school system that has to opt in. I think we've had 114,142 tests that have been conducted as of 8 a.m. today in that program. 6 out of 15 ad districts have over 75% participation. One ad district has 100%. That's Northern Kentucky with its different systems there. They've resulted in 4,042 positive individuals identified. That's really important. That lets us isolate and ensure that it doesn't spread further. And spending to date on it about $10.95 million specifically. So just a couple of numbers there to report. Team Kentucky Healthy at Home Eviction Relief Fund. We've seen a lot more applications in the last couple of weeks. That's good. Keep them up. Nobody needs to be evicted from their home right now because we have the money to help you. For landlords, that means you can get more than 6 months, I believe, of back rent and months going forward as well. Those are dollars you would not get by simply evicting a tenant. So if you combine what we have worked with Louisville and Lexington on, those were the state funds that we provided extra to them, as well as ones that we have done directly, where we are right now is 139 million left for Kentuckians. So still a significant amount. Go on and apply for that. We've done 68 million direct from the state. We provided another 38 extra $1 million to Louisville and Lexington that then provided that assistance on top of theirs. So what is that? That is $106 million from the fund overall, 139 left. With that, I'm going to turn it over to Dr. Stack, who's going to go through the new Merck pharmaceutical that is pending that may help those suffering from COVID, boosters, as well as kids 5 to 11, and I think maybe one more thing.
Thank you, Governor, and good afternoon, everyone. Jim, if you have my slides, please. So I'm going to mention a little bit briefly about the Merck oral antiviral medication, molnupiravir. It's getting a little bit harder to pronounce some of these newer chemical names these days. The preliminary data that Merck provided showed in a sample size of a little over 700 people about a 50% reduction in those who had mild to moderate COVID progressing to severe COVID. This was about 14% of the people in the placebo group, or the group that didn't get the medicine, went on to be hospitalized or die, and 7% of the people who got the medication went on to be hospitalized or die. That's how they get to this 50% reduction. This was an early finding in the research, but it was so compelling and so statistically reliable that they decided to go forward and ask the FDA to review it for approval. That meeting will happen on November 30th at the FDA. And then after that would be the time that this could potentially be available. This is not a replacement for vaccination. It would be similar to when people take Tamiflu, if you get exposed to or you get sick with the influenza virus. It will not be available in large quantities in the early months. The federal government has apparently contracted for about 1.7 million doses. That's for the whole nation. So in the early months, the distribution will be limited and be targeted at those people who are particularly high risk for going on to hospitalization and death. So that is the new Merck oral antiviral. It's a wonderful accomplishment, though, for science to get this much progress this quickly. Again, it's another tool in the toolbox to try to bring this disease to heal. Jim, the next slide, please. The Moderna booster. The FDA had a meeting on October 15th, so last week. At that meeting, they recommended guidelines very similar or identical to what the Pfizer booster would say, so that people who are 65 and older should be eligible for a third dose and for a booster dose. People who are 50 and older and have high-risk medical conditions should be eligible for a booster of Moderna. Also, people who are 18 or older who are in high-risk professions or who are in particularly high risk for severe disease should be made available the booster. They're not required to get it, but they should be offered to get it. And so that's pretty much identical to what was recommended for Pfizer. There will be a follow-up meeting in the next couple of days where the CDC's parallel committee will review the data and make the final recommendations. And then both the FDA commissioner and the CDC director will make their agency recommendations. So by the end of this week, hopefully by the close of business Friday or thereabouts, we'll have some clarity about the actual language for the Moderna booster. And I would imagine, though there may be some limited availability this coming weekend, probably next week will be when we have widespread availability of the booster doses for Moderna. Those doses, for most people, just so you're not surprised, will be a half dose compared to the first 2 doses you received. And that's what the research was based on. Next slide, Jim. The J&J or Janssen vaccine. That That's the 1-dose vaccine. It has some benefits because it doesn't have to be frozen in the same way as the mRNA vaccines. That vaccine is currently a 1-dose series. The evidence supports making available to all persons, so that's all persons 18 and older who have received a J&J vaccine, that you should all be eligible for a booster dose of the J&J 2 months or more after your initial dose. So if you have received J&J, once the CDC makes its review and the two agencies make their recommendations, next week it is anticipated you are likely to have access to a booster. And if you have received J&J, I would encourage you to go out and get a booster. When you get that booster, particularly for people who received their vaccine 6 months or more ago, the science appears to show that your protection goes up over 90%. So this now starts to get in the range of the mRNA vaccines if you get a second dose of J&J, which is wonderful news for folks to get comparable protection with that extra dose of vaccine. For all of these vaccines, before I move on to my next slide, I encourage you to either talk with your personal healthcare provider who, if they're vaccinating, may have access to these. But since a lot of offices have not taken on the vaccines because there's a substantial amount of documentation requirements that go with it, you can go to the COVID-19 website, kycovid19.ky.gov, and there's a link to the CDC's vaccine finder. If you go there, you can actually put in your zip code and it'll tell you sites that are near you within a radius you define that have the specific type of vaccine you're looking for, and then you can reach out to that specific site and make an appointment. Remember, there is no charge to get these vaccine doses at this time. The next slide, please. So now we're going to talk about vaccination for children 5 to 11 years of age. Currently, vaccines are not available for COVID-19 for persons under 12, so this will be a big development when this happens. The meeting for the FDA committee that advises on this is scheduled for October 26th, and the CDC's parallel committee has a meeting scheduled November 2 and 3. They may move that up a little earlier, or they may not. That is yet to be determined. At any rate, it is widely anticipated that the Pfizer vaccine will be approved for children 5 to 11 years of age. When that happens, if I remember correctly, it's an estimation of about 28 million children in the United States in that age category. And in Kentucky, it's about 389,000 children 5 to 11 years of age. All of them would be eligible for the vaccine if approved, as we anticipate. It is likely that in the early part of November, the first week or so, this is when it would be available. The federal government, rather, has obtained enough vaccine probably to meet half of that population over the first few weeks. And then they'll continue, obviously, to get ongoing supplies, and we'll be able to catch up with the rest. And we are already engaged in planning, and as are all the other states, in partnership with the federal government for pre-positioning some of this vaccine and distributing it throughout the state. I have no doubt that there will be widespread availability. You may have to be patient just in the first couple of weeks, though, because it's a matter of distribution and trying to get it where the demand is the most, and also doing that in a fair and equitable manner. So I'm very confident within the first few weeks that any parent who wants to have their child vaccinate should have access to these vaccines. I do want to show one more thing real quick. For those of you who may get a vaccine for your child, and certainly for those who are administering them, the adult product for Pfizer is packaged, or will be packaged, in a bottle with a purple cap and purple language. The pediatric one will be in an orange, or bottle with an orange cap and orange language. This is very, very important. You cannot take the adult dose or the adult product and use it on kids 5 to 11. The actual amount of medication, a vaccine dose in the child's vaccine, is about 1/3 of what's in the adult. If you try to take the adult product and dilute it in order to make it appropriate for a kid, the size of the volume is less than 0.1 milliliters, which is considered to be too small to be reliable and is not tested for these intramuscular injections. So they are making specific pediatric concentration bottles specifically for kids 5 to 11 years of age. And those will be what's available to any provider who is going to vaccinate children. on the CDC's COVID vaccine finder, you will be able to search. They have told us that you'll be able to check a box and find the ones that are offering pediatric vaccinations. And of course, we're working with pediatricians across the state as well, those who are participating in this program and who participate in the Vaccine for Children's program, to try to make available to them the vaccine so that they can offer to their patient population as well. So folks, the vaccines continue to be working very, very well. If you look at the data the governor showed before, it's great to see that the metrics are all trending positive after so much distress we've gone through these last couple or few months. The vaccines, though, are what made it even remotely survivable. Had we had this surge last winter when we had no vaccines, we would have seen happen here what happened in China when this whole pandemic first began. The vaccines are what made a horrible situation survivable instead of just absolutely catastrophic. And so they clearly have done their work. I hope you'll all take advantage of these vaccines, and when they're available for your children, I certainly hope you'll avail yourself of that and get them the same protection. And that's all I have. Great. Thank you. I'm upside down.
I'm guessing some of these questions will be for you. So we will move right into questions. Tom Latek.
Well, thank you, Governor. The fact that the hospitals are getting in better shape and the number of cases are reducing, does this mean the outside help from FEMA, the Kentucky National Guard, and that, is that going to be reducing over?
So if we continue to see the decline, then yes, there will be a point when there will be reductions in outside assistance. Certainly some of the FEMA is already gone. Some of it is on extension. We have moved the Guard around to different places in the state. It is a slightly smaller group now than at the height. But what you'll see is it'll be hospital by hospital, area by area that we make those reductions. Chad Hedrick.
In terms of masking in schools, are there any conversations with you and the Department of Education, two districts? I know some said once their county went orange or especially yellow, they would drop their policy. And kind of elaborate a little bit more on that.
So there is no distance or room at all between the Kentucky Department of Education and our administration and DPH in our belief that there should be universal masking in every school across Kentucky for a couple of reasons. Number one, we want our kids to stay in school. The only way to do that is to keep COVID from spreading or reduce the spread. Number two, we want to protect especially the most susceptible kids that have various conditions that may make them susceptible, and teachers and administrators. We've lost 50 of them. I don't want to lose a 51st or a 52nd. And it's the fastest way that a community will go from maybe getting to yellow way back to red as fast as it can happen. It's the largest group that comes together with the lowest vaccination rate and the most poorly ventilated group, and then goes back to parents, and nobody's wearing masks, nor should they. But you can see how that spread can work. So we continue to have any and all communications that we can. I know KDE works directly with folks. I'm very concerned that there are some districts that are considering or may have already let up when they're still in the red, but certainly I would not do it in the orange. I'd try to get to the green or at least the yellow. But I mean, if you really want to stay in school, keep them on until we're in a better place. Drew.
Is there any update on the $400 million essential worker bonuses? I know you sent those letters to lawmakers on developing the work group. Any movement on getting that group together, or where that stands? The Minority Caucus has sent us the names that they want to serve, one from the House and one from the Senate. I believe we have the Senate. We are waiting on the majority. I hope that they do send us some names, because this is something that we at least ought to talk through. I think we're doing this, or my proposal is the manner that they've asked for at different points during COVID, which is consultation. Let's get folks in a room and discuss it. Now, you know, it's ultimately going to be codified, we hope, in legislation in the beginning of the session. So I'm not worried that I haven't heard from them yet, but we do want them to participate and be a part. This is a chance, again, I think, to provide
an incentive to our healthcare workers to keep it up. But remember, when you look at the supply chain issues we got right now, it's an incentive for a lot of essential workers to keep it up. You know, we ought to look at truck drivers and grocery store workers and so many others that have been so important. Certainly our social workers need to be included in that too, doing dangerous work in the middle of COVID for far too little money. So I hope those conversations will continue in earnest. I think we showed our good faith by not just throwing out a fully detailed, fully decided plan and saying we really want to work together. Let's see. Skipped right over Mike Valenti.
Wanted to ask a question about two bills that are kind of hanging in limbo in DC: the bipartisan infrastructure bill and the Build Back Better bill. There's some consternation about, should Congress vote on both of them at the same time and two-track vote or just the infrastructure bill first. Would you like to see the Build Back Better or the social spending bill passed in addition to the bipartisan infrastructure bill?
So I think the bipartisan infrastructure bill should be passed immediately. I think when you have agreement, you should go ahead and take that step. The types of infrastructure that are included for Kentucky can be game-changing, create jobs, continue our economic development momentum. We have an economy on fire, and if we have extra money to improve our infrastructure from roads to bridges to broadband, there is absolutely no stopping us. Now is the time to invest, and we can do that in coordination with the way that we are growing and where these things are coming from. I believe in a lot of the Build Back Better bill. Obviously, there have been some things that I've objected to that hit Kentucky a little harder on the how to pay side. But I believe that especially the child care and some of the other funding in there is critical if we want to give everybody true opportunity in the workforce. Now, where they are right now, do I think that they should look at the most important pieces and talk about those? Yes, I think that is worth doing. But pass that infrastructure bill right away, and that will address some of the blips we're seeing in our economy. Though certainly, I think we're making out a lot better in Kentucky right now. And again, all eyes are on us. Every boardroom in America is talking about us. Every nation across the globe knows now not only who we are, but where we are. And that transportation bill could help take us to the next level or get us there faster. All right, on the line, Karen Czar.
Governor, thank you. I have one for you and one for Dr. Stack. For you, could you reiterate the guidance for Halloween, especially with many of the children who will be trick-or-treating are unvaccinated? And then for Dr. Stack, what should parents, once they are able to get their children 5 through 11 vaccinated, what should they be looking for as far as potential side effects to the vaccine? And at what point I guess, is it similar to what we were seeing in some adults? Thank you.
All right, for Halloween, be mindful of whether you are inside or outside. Certainly when you are inside with members outside of your family, you ought to be wearing a mask. And a lot of people let their guard down on the holidays, and we've seen spikes after the holidays. Now, most of Halloween, I hope, is conducted outside. The more you can do outside, the better. And then the less contact and a little more distance that you can have, especially in trick-or-treating. Maybe you don't have to go as far as we went last year, though people got creative, and I think people had fun with it. But having a table or a basket that you set out instead of reaching over someone that might be unvaccinated and having that extra contact just gives them an extra level of protection. Remember, we all have a responsibility to protect our kids, so we don't want to get them infected. Likewise, our kids being unvaccinated primarily would be the ones that could have absolutely no symptoms and pose a risk to you, whether vaccinated or not, depending on how much your exposure is. But at this point, Karen, we all know how this thing spreads. It's just being willing and making the decision to keep up at least minimal protections. We see a lot of wanting to be fully back to normal, and we can be a whole lot back to normal, but we can also be a little bit careful, which we would regularly do in other times, we were seeing far less sickness than we're seeing now. Dr. Stack?
Thank you, Karen. So far, for what we know, the side effects for kids are no worse and probably more mild for the younger kids than for adults. It's the typical things where you might get some aches or a sore spot where you receive the injection, maybe feel crummy for a day or so. But kids bounce back so quickly, and there's no report of any significant side effects, certainly nothing any worse than the adults have, and probably less so. So I would solidly encourage you to go ahead and get your kids vaccinated. Remember, the things we don't know over the long haul are not just your risk for acute COVID to go into the hospital and to die, which thank goodness does not happen very often for kids, but things in kids that are unique, like the multi-system inflammatory condition that a very small number of them can get, but is very serious and does make some of them very ill. And then long COVID. We really do not know yet. We don't know what the longer term effects are. And I think that's one of the biggest concerns we have in the pediatric population is, since we know that the virus can impact people's hearts and some of their other organs, is what are the long-term consequences of having it. So I think if the FDA and CDC recommend the shots for kids, I would definitely recommend that every parent who has an eligible child go ahead and get their child vaccinated.
On a personal note, my 12-year-old had zero reaction to the vaccine, no side effects, and I intend to take my 11-year-old as soon as it is possible. I believe in the science. I believe in the studies. I believe in this vaccine, and I very much believe that COVID has implications and damage that we have not yet calculated, seen, or understood. I believe that I will be doing the right thing by her, being her parent, for her long-term health, by getting that vaccine. Debbie Yetter, Courier Journal.
Hi, Governor. Do you have an update on vaccination rates in Kentucky? And also, can you say how equity is proceeding in vaccination rates by ethnicity and race?
Sure. We're going to have more on some of the age demographics, we believe, on Thursday. We are reviewing some of that data because we see in some counties 100+% of a certain age group, and wanting to fully understand that. We're actually in talks with the CDC over that as well. In terms of race, it looks like we have, here it is. Remember, we have an other category here too, which throws things off from our other population statistics. We look at, of all of the vaccines that have been given, 81.2%, white, 6.9%, Black or African American, 1.9%, Asian, 0.2%, American Indian, 0.1%, Native Hawaiian. What that breaks out to is about 3.36 million vaccines, white Kentuckians, 314,265 to Black or African American Kentuckians, 59,630 to Asian American Kentuckians, and the rest is in there. Now, 9.7% of all of our vaccinations are in this other category, and I think that the way some may either fill out race, or some providers not be recording it, especially early on, does throw off the way that we can compare these figures directly to the overall makeup of the population, because our other category isn't anywhere near that when we look at that demographic. I believe as of today, our numbers are 62% of all Kentuckians having received at least their first dose of the vaccine. Melissa Patrick, Kentucky Health News.
Hi, Governor. I guess I'm wondering if you've done an update lately on the number of long-term care staff that have been vaccinated. And then more specifically, how many Kentucky nursing homes will be impacted by President Biden's rule that employers with more than 100 employees require vaccinations or have weekly testing?
Both good questions, and let me work on getting the answer to both either before or for Thursday, because Melissa's exactly right in that the homes that take Medicaid now have to have people to get vaccinated or to meet a testing requirement. And then outside of that, which is a second question that we haven't calculated, how many of them will have enough employees to either have a specific number of tests per week or get vaccinated. Let's do remember, because we're still waiting on the state and knowing if the state is going to fall under that, which we believe it probably will, because decades ago we opted into a federal OSHA program that, while they call it a vaccine mandate, it is a testing mandate. And the amount you have to get tested is determined by whether you are vaccinated. So that mandate won't require an individual who's unvaccinated to get vaccinated, but it will require them to get a test every week until they get vaccinated. So I do think that what people call things, they may call depending on what they think is best in their situation or area. But the only really mandated thing here is the test. Now, we'll be ready if it does apply to us to do that. It will help us find more people who become positive and thus prevent the virus from spreading if we have to do it, because those that are unvaccinated are more likely to get infected and spread the infection. So knowing about it early will be helpful. Now, it will be expensive. It'll be really expensive, but we're ready if we have to go in that direction. Remember, there are already some areas in our state apparatus, like corrections officers, those who work at our VA homes, that we already have that testing mandate in place. I think we have somebody on from WTVQ, but I don't have nope. All right, then no, Stu Johnson with our last question.
Right. Thank you, Governor. Good afternoon. In your briefings, has there been consideration given to detailing the number of people that have passed away who are vaccinated and are not vaccinated, to break that down? And then secondly, what percentage of cases now are breakthrough cases?
Stu, we can send that information to you. I don't have that printout on me today. We can certainly show it on Thursday. The numbers haven't moved that much from last week when we show, remember, cases and hospitalizations and deaths. The hospitalizations, about 92% unvaccinated. Steve, where are we on the cases now?
It's a 4 to 1. It's a 4.3 to 1 ratio.
Yeah, but I was trying to think of 80 something percent of all cases, 82% of all cases unvaccinated. But Stu, we'll send you that. We've got that broken down, as well as the overall numbers of deaths. Now, when it comes to deaths, when we look at unvaccinated versus vaccinated, there's some extra nuance there. Virtually every death of people under 50 have been unvaccinated. That if you are under 50 and you get the vaccine, you with some very rare exceptions, you don't die. But a number of folks that we read every single day under 50, all unvaccinated, passing away when they have decades left in this world. The breakthrough cases resulting in deaths, we believe a lot of them, maybe like General Powell, are from folks that have an underlying condition that made them vulnerable when we first started this thing that we talked about. We believe that the boosters are critical to those individuals and are going to significantly help them. That's why if you got Pfizer, go ahead and get your booster if you're over the age of 65 or you have any of those conditions. You can go ahead and get a booster of Moderna if you are immunocompromised or have one of those major conditions with, we think, the FDA and the CDC approving it for a lot more people here shortly. So in the end, the numbers haven't changed a lot by percentage. You're a lot better protected if you are vaccinated, a whole lot more than unvaccinated. And if you suffer from one of those underlying conditions, certainly get that booster as soon as it is approved. All right, folks, we went just a little bit earlier today, 46 minutes. I'll see if we can do it slightly shorter the next time. I want to thank everybody for giving me last week off. Had an amazing time with 2 great kids and an amazing wife, refreshed, ready to keep up this fight. We're going to defeat this pandemic, and we're going to race into our future. Thank y'all.